Hi, this is Philip Tennent Slack, medical doctor with InnovationMD, and this is
Ricardo Boye, registered dietitian and naturopath here at InnovationMD.
As you probably can tell, this is our first excursion into the video world, so I personally don't feel very adept at it. Ricardo here is a movie star in his home country of Chile, so he's going to be a real natural with this. So kick it off, brother.
Okay, well, we wanted to just introduce ourselves to you all, and I wanted to ask you, Dr. Slack, what is InnovationMD? What is the thinking behind this, and how did our work come together?
Well, so it occurred to me really years ago. I trained in anesthesiology and practiced anesthesia in Atlanta for quite a long time, and then much to the dismay of my partners, went back and did a fellowship in pain medicine at the Medical College of Georgia, did my other medical training at Emory, and it became very clear to me immediately that more tools were needed to treat people with chronic pain. Right. More tools than were allowed in the insurance covered toolbox. And then kind of simultaneously, I got very involved with prescription opioid reform at the state level through the Medical Association of Georgia and a program called Think About It. So that further drove me to look for other ways to treat pain. Right. And I particularly wanted to focus on ways that promote healing from within, utilizing the body's own very, very powerful intrinsic healing mechanisms. Yes. In fact, I think you could argue that the body is the major workhorse when it comes to healing any disease.
Correct. Which is the naturopathic philosophy.
That is. It is the naturopathic philosophy, the holistic philosophy. Yeah. And if the body's ability to heal is impaired, then you're in really tough shape.
It is. It's difficult.
So the first method I began looking at was platelet-rich plasma, where we take somebody's blood and we spin it and then take concentrated platelets, which are full of growth factors, and inject those into very specific locations to promote growth and healing in that area. And I would be very quick to say that these methods are not designed to regrow a new anything. Right. It is designed, the thrust is to improve the microscopic environment such that it's a pro-healing environment and a less inflammatory environment.
Exactly.
And on that, with that premise, using that as the premise to reduce symptoms.
Yes.
The reality of current pain treatment is that's covered by insurance is that it is largely, not to say it's not very effective for a lot of people, it is, but it is really not based on ramping up healing.
Right. Yes.
Steroids are very, very good anti-inflammatory agents, and that can profoundly reduce symptoms. At any rate, what I found was that I was really exposing my patients to a lot of pharmaceuticals and a lot of steroids, and I wanted more tools. Yeah. And so as I began to further explore the quote alternative arena, I found various tools and options out there that I thought, several of which I thought were worthy of merit. And I think there is a tendency when it comes to alternative to for traditional medicine to sort of throw that entire animal out with the bathwater.
Yes.
And so basically I wanted to create a bridge between traditional treatments and non-traditional treatments so that patients could have a quality and legitimate additional set of tools if they are not flourishing with the normal tools. That's really it in a nutshell. And then I guess word, I've been conceptualizing this for years, and I guess word got out to you through a mutual friend. Right. And then you and I started talking, and it was very clear that we had shared similar thoughts in this whole arena.
Yeah, mutual interests.
And it was very clear to me that lifestyle is essential. And as I tell people, whenever and teaching them about these other methods, that you can, lifestyle is the single most important element in the entire picture. It doesn't matter what anybody does to you it doesn't matter what it is, whether it's a mind intervention or all the way over to surgical intervention. If your lifestyle is, if the major elements of your lifestyle, if even one of them is way off, then it's very unlikely you're going to benefit from whatever it is that is done to you.
Right. I mean, there's even something now called lifestyle medicine.
Right. Exactly.
I mean, it's very legitimate
Yes.
in the whole scope of medical intervention.
So, the arena of integrative medicine,
Yes.
functional medicine, there are major institutions that have entire divisions. Cleveland Clinic, for
Yes.
example, has a functional medicine division. So
Correct.
this whole approach is coming more and more
Yes.
on the radar, and I think people are very interested in
Yeah.
it. And you've been in practice here in Gainesville for how long?
Since 2005.
Yep, 2005.
15
So
years.
this whole approach is much newer to me than it is to you. I mean, your entire career has been centered around this concept of healing.
Right, but what's interesting is the joining of what you're saying, right? So if we can draw a spectrum of kind of healthcare approaches, let's just kind of draw that in our minds. One, we have the medical traditional approaches, and the other, let's call it complementary and alternative medicine. Integrative medicine is where these meet. It's like what you were saying, the bridge that we can draw from the best of both worlds, and we can see and capitalize on their strengths, because one perspective will not have all the tools that are needed for helping the whole population.
Right. And along those lines, there's considerable misinformation on both sides. I mean, there are relatively few, I think, thinkers in this realm that embrace, that allow for both to embrace the benefits of traditional and the benefits of non-traditional. And honestly, they tend to badmouth each other a lot. There are, I've been to several alternative meetings in which the trainer or teacher says, you should never get exposed to a steroid ever. And, that's just silly.
It is silly.
So really, there's room for both parties to come together and have a logical conversation and a scientifically based conversation and pull out the best of both worlds.
That's exactly right, and it can be done. And that's what we're trying to do here at InnovationMD here in Gainesville. In the context of inflammatory pain disorders, but it really, as Dr. Slack was saying, there's so much more that's involved. If a person has a dominant inflammatory condition that maybe is coming from their gut, that is going to play a role in some capacity, or possibly in their pain syndrome.
Oh, no question. I think the shift towards a baseline chronic inflammatory scenario is, there are those who believe it's the basis for all disease.
Exactly.
And so there is no question that people with complex pain pictures, particularly when the pain is widespread and moves around and it's here, it's there, and you combine fatigue and poor sleep, I think it is certainly worthy of considering an underlying inflammatory source in those patients, and the gut is huge. I mean, if you think about the gut, it's basically a highly sophisticated sewage system inside you, and any sewage system that leaks into the fresh water area is going to be a real problem. And so if the gut is at the microscopic level allowing materials to come in that are not meant to be in, they can really create havoc in the immune system.
Correct. Exactly. And that's, the complexity of the gut. What you're referring to is the microbiome, right? Where these bacteria should be in the gut. But there is a type of a permeability that these bacteria can escape along with other undigested food particles, and then create this kind of like sewage problem that you were referring to, that the body is not equipped to deal with. And then the response is inflammation. And then inflammation is now seen as a symptom in all these various disorders where, we try to manage it, but what is the source? Right. Trying to get to the source.
Where is it? How far upstream can you go? And
And that's just one example of the gut. It's not
Yeah, yeah, no, of
exclusive.
course. It's the focus here is really the mind and the body and the whole package. But we could easily just ramble on about all of these concepts.
Yes.
Basically, we offer a comprehensive tool set here, I think, which is very robust, and I think would be on par with about anywhere really, except that we're in Gainesville, Georgia. And we have a full array of regenerative targeted injections with pro-healing materials. We have a very robust array of device-driven treatments, from near-infrared light to ozone to pulsed electromagnetic technologies. And through Ricardo, we have a very strong integrative medicine and nutrition approach.
Yes.
So if you want to know more about all of this, go to our website at InnovationMD, and you'll see a lot more information. And then Ricardo and I really hope to generate enough interest so that we can take questions from the public and maybe build a small lecture around that in response.
Absolutely.
So for now, we will sign off, and we hope you have a great day. Thank you.
Thank you. Very good.
Now, do you want to go ahead and do, it's 9:30, you want to go ahead and do a gut one?
Yeah, let's do it.
Yeah.
Okay.
All right.
Unrehearsed, but kind of like
Chief,
on the
was
line.
this rehearsed? I
No,
don't think
that's
this
what I'm
was
saying.
rehearsed.
That's the
I
way.
don't recall any rehearsal on this.
Got to get
You
your
just got
wheels
through
greased.
saying, man.
That's right.
All right, so
Make-
this was gonna
Okay.
be, well, it's just similar to the
Yeah.
the lead-in before.
Yes. Okay.
And,
So, we just go off on it.
Yeah, Chief.
Maybe
yeah,
keep it
you know,
5 minutes.
Yeah. Okay. What did we do? We kept it under 10 minutes.
Yeah. Yeah, that's good.
That's good. So if you want to set it for 5 minutes, can you keep it on where we can see it? Don't
Yeah,
you?
yeah. Well.
Oh,
then we get-
9:30 was the time.
Yeah.
Oh, how long did we go on that?
I didn't do it.
You're killing me.
It's probably like 10 minutes.
Chief, I asked you to put on the
I
timer.
hear you, but I don't want to get distracted because every little distraction kind of keeps away from the charge. That's my approach.
Yeah,
You let it fly and then you edit, right? I know.
Simple request.
You can't do it.
Can't do
See, then we don't want to see that because then we're like,
We have 30 seconds left. Go. I don't think that was too long.
It wasn't too long
Yeah.
for an introductory one, but I tell you, people's attention spans today.
Very short.
They're
Very
saying
short.
2-3 minutes, just keep it.
Yeah. Okay. Hi, Philip Tennent Slack here, medical doctor at InnovationMD. I'm here with my colleague.
Ricardo Boye, naturopath and registered dietitian at InnovationMD.
So we today are going to discuss a very important concept, which is the food as medicine concept. And in that arena, Ricardo is an undisputed expert. So tell us about the importance of food and the gut in wellness and pain and everything else.
Yes. Okay. Well, it's a big question.
We're going to keep it short.
You keep it short, but the whole premise is we start with the foundation, the principle that the body can heal itself, right? So if we admit that into our thinking, right, then we have to think about healthcare strategies that support that. And just as a plant, if you have your perfectly potted plant in the corner of your bedroom, you go away for a vacation, right? 1 week later, the plant's all withered, right? What do you do with the plant? It's not like you put sticks and try to kind of prop it up, right? You think about, well, what about the water? What about the soil? What about fresh air? What did I not do to help support the natural, what the plant would naturally do, which is grow healthily, right? That is food as medicine. And we have to admit today in our 21st century modern world that through various evolutions of our food industries, some for the better, some for the worse, there have been shortcomings when it comes to this whole principle that food is medicine. How to really have a diet that satisfies the body's basic needs, but then pushes the limits on its immune system and its protection from any ongoing disease. On our last video, we talked about inflammation. the quality of our food and the components of our food have been shown to show and demonstrate a very profound either inflammatory effect, which is what you don't want with the standard American diet, or an anti-inflammatory effect when we really construct a diet on proper balance, right? And we're talking about, the right kinds of foods, of proteins, and right kinds of carbohydrates, or right kinds of fats. All of those can create a very supportive, pro-healing environment. That is food as medicine. And unfortunately, in today's rapid healthcare industry, food and diet has been kind of pushed to the background of our healthcare efforts. But what all the research is showing is that it needs to be put to the foreground. This is what we're doing here.
Absolutely.
And
I can tell you, when I trained in medical school, very, very little time was given to nutrition.
Right.
Really, it was pitiful. And really, food, all the components of food, lipids, carbohydrates, proteins, they all have pharmacologic effects inside your body. I mean, that's
drug-like effects.
Yeah,
that's
that's right. Like a pharmaceutical type effects. Yeah. Just like a drug that you buy at a drugstore does. They activate all sorts of internal machinery. And so, as Ricardo has suggested, the idea is to take advantage of those pharmacological effects to optimize your healing potential and your overall health.
Right. Because it could be the thing that is holding you back.
Yes.
And then everybody tries to scramble around that and trying to deal with the consequences of the body's inability to heal itself. But we're saying as long as the body's alive, that healing capacity is at least in potential. Mm-hmm. If it's not getting displayed, it's not like it's gone.
Right.
Because you're still alive, right?
That's exactly.
And we just need to optimize the environment.
That's it.
Yeah.
Well, so we will have more details about all of this, and through Ricardo, we offer customized approaches, individualized approaches to dietary considerations, nutritional considerations, integrative medicine considerations. So we will talk more about it in the future. Y'all have a great day. Thank you.